If you enjoy this podcast summary, please consider subscribing. Dr. Sara Szal is a physician who has worked in academic medicine, doing research, teaching, and taking care of patients. She considers herself a healer, connecting with people's innate healing capacity and working with them to activate it. Her approach is centered around understanding what obstacles might be preventing someone from healing and helping them become the best version of themselves. Dr. Szal's training is in bioengineering, and she did the Harvard MIT program, which aimed to train physician scientists. She became a surgeon and did primary care after completing a residency in obstetrics and gynecology. She also worked with men, which is unusual for an OB-GYN. Dr. Szal's experience has given her a unique perspective, and she's drawn upon various reference points in her career. She is the director of precision medicine at the Marcus Institute in Philadelphia. Precision medicine differs from conventional medicine in that it focuses on understanding the individual, looking at their genomic blueprint, biomarkers, and wearables data to determine the most effective treatment. Conventional medicine, on the other hand, is often based on randomized trials and focuses on treating the average person rather than the individual. Dr. Szal believes that conventional medicine is broken, citing the fact that 70% of diseases are preventable with lifestyle medicine, but the healthcare system focuses on pharmaceuticals instead. She also notes that hormones are often overlooked, despite being a crucial aspect of health. Dr. Szal's own journey with hormone imbalance began when she was 34 and trying to get pregnant. She realized that her hormones were out of balance and began to study the scientific literature to help herself and her patients. Dr. Szal's ACE score, which measures adverse childhood experiences, is 6 out of 10. She believes that understanding one's early upbringing and trauma is crucial for healing as an adult. Her own trauma manifested in physical health issues, including depression, premenstrual syndrome, and belly fat. She went on a journey to heal herself, starting with awareness and then applying the scientific literature to her situation. Dr. Szal's approach to healing involves understanding the science and then applying it to the individual through N-of-1 experiments. She notes that cortisol is a critical hormone that can be affected by stress, but it's not as simple as just reducing stress to lower cortisol levels. High cortisol levels can lead to depression, belly fat, and brain shrinkage, particularly in women. There is also a link between cortisol and trauma, with people who experience trauma often having high cortisol levels. Dr. Szal's journey has taught her the importance of understanding the individual and addressing the root causes of health issues, rather than just treating symptoms. She believes that precision medicine is the future of healthcare, and that by understanding the individual, we can provide more effective treatment and prevention. However, for those with post-traumatic stress disorder, cortisol levels may eventually drop due to the body's inability to sustain high levels.
Stephen Bartlett asks Dr. Szal about the factors that disrupt hormone balance in today's world. These toxins can be found in everyday products such as plastics, skincare, and cleaning supplies.
Dr. Szal also notes that the current state of societal dysregulation, possibly exacerbated by the pandemic and changes in leadership, is affecting her patients' hormone balance.
Stephen Bartlett shares his observation that the increasing digitalization of the world is contributing to this dysregulation.
Dr. Szal agrees, pointing out that the attention economy created by social media algorithms can lead to nervous system dysregulation. Dr. Szal emphasizes the importance of monitoring food intake, particularly protein and carbohydrate consumption, and utilizing tools like continuous glucose monitors to track blood sugar levels. She notes that sugar is not inherently the enemy, but rather the way it is consumed in excess, often as a coping mechanism for emotional issues. When discussing blood sugar levels, Dr. Szal explains that she focuses on this aspect when treating patients, as it provides insight into the body's metabolic function and energy production. She also mentions that ATP, the energy compound produced by cells, is crucial for maintaining energy levels. Regarding supplements, Dr. Szal suggests that individuals should consider their genomic vulnerabilities and work around them. For example, she takes increased levels of vitamin D due to her own genomic vulnerability. Dr. Szal shares a case study of a 52-year-old executive who had high cortisol levels, pre-diabetic glucose levels, and inflammation. She worked with him to address these issues through exercise, supplements, and stress management. The executive's identity as an athlete was also leveraged to motivate him to make lifestyle changes.
Stephen Bartlett asks about the prevalence of cortisol imbalances in the population.
Dr. Szal estimates that around 30–50% of the general population may have cortisol issues, although this is speculative. She notes that 90% of her patients have cortisol problems, but this may be due to her patient population being enriched with individuals who have cortisol issues. Dr. Szal discusses various methods for managing cortisol levels, including meditation, breath work, and supplements like ashwagandha and phosphatidylcholine. The conversation turns to the topic of behavior change, with Dr. Szal acknowledging that it is a challenging process. She emphasizes the importance of finding the right motivation and accountability, such as using a continuous glucose monitor. However, she also notes that some people may need to experience a certain level of pain or discomfort before they are made learning from video. Dr. Szal emphasizes that estrogen levels play a crucial role in controlling weight, particularly in women. She notes that cortisol imbalances, often caused by stress and trauma, can lead to depression, belly fat, and brain shrinkage. To manage cortisol levels, Dr. Szal recommends meditation, breathwork, and supplements like ashwagandha and phosphatidylcholine. She also stresses the importance of understanding individual genomic vulnerabilities and addressing root causes of health issues rather than just treating symptoms. Additionally, Dr. Szal discusses the impact of estrogen and testosterone on women's health, including weight distribution and libido. She also touches on the importance of the microbiome in hormone function and the potential benefits and drawbacks of the ketogenic diet. Overall, Dr. Szal's approach focuses on precision medicine, understanding the individual, and addressing the root causes of health issues. By adopting this approach, individuals can take control of their hormone balance and overall health. Key takeaways include the importance of monitoring food intake, utilizing tools like continuous glucose monitors, and finding the right motivation and accountability for behavior change. By applying these insights, individuals can improve their hormone balance, reduce belly fat, and achieve overall wellness. If you are interested to listen to complete 11-minute summary and unlock detailed insights for each topic discussed in the video, check out quick podcast summaries on Spotify and Apple Podcasts with free trial and later, just for the price of candy. Happy listening.